Good day everyone, I'm Jhun Fel, and in this course I take 11 Living in the IT Era. We are going to talk about coronavirus COVID-19. So, coronavirus are a large family of viruses that cause illness ranging from a common cold to more severe diseases such as Middle East Respiratory Syndrome, or also known as the MERS-CoV, and severe acute respiratory syndrome, or also known as the SARS-CoV. So basically, COVID-19 is an infection disease caused by severe acute respiratory syndrome. So now let's talk about when was COVID-19 first identified. So on 31 December 2019, the World Health Organization was informed of cases of pneumonia of unknown cause in Wuhan City, China. A novel coronavirus was identified as the cause by Chinese authorities on January 2020. This is the time that a lot of people heard about these viruses, and a lot of news from televisions, from the internet, and lots of people are alarmed. So it was temporarily named at the time as the 2019 nCoV. So now let's talk about the COVID-19 coronavirus disease 2019. So there's a research team said that the COVID-19 may originate in bats. So in addition, the genuine sequencing of the novel coronavirus is as high as 96% identical with the type of coronavirus from the bats. So that's the research team said that it has a 96% identical to the virus the same with the bats. Also, the team said that the new coronavirus enters the receptor using the same cells with SARS virus. So now let's updates on COVID-19 globally. So the cases of COVID-19 infections around the world are as follows as of the moment. So it has active cases of 528 million and a deaths of 6.28 million. So how to prevent from getting COVID-19? So first, let's wash our hands frequently. Uh, we all know that washing our hands is very important. So how to wash our hands? Basically, let's just have to sing happy birthday. Let's wash our hands in singing of happy birthday song. So second, let's maintain social distancing, that is 1 meter. And also third is we should avoid touching our eyes. Also, we should practice respiratory hygiene. Make sure to cover your mouth or nose when sneezing or coughing. Use disposable tissue whenever you can. Just a simple practicing a hygiene. Next is we should also watch for symptoms. So people with the COVID-19 have a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. Anyone can have mild to severe symptoms. So a few examples of symptoms of COVID-19 are fever or chills, cough, shortness of breath or difficulty of breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion, or runny nose, nausea or vomiting, and diarrhea. So those are some symptoms of COVID-19. So now, let's also learn the difference between flu and COVID-19. So the flu or also influenza and COVID-19 are both contagious respiratory illness, but they are caused by different viruses. So COVID-19 is caused by infection with a coronavirus first identified in 2019, and flu is caused by infections with influenza viruses. So basically, the difference between flu and COVID-19 is that COVID-19 is an infection with a coronavirus identified in 2019, and the flu is an influenza viruses. Next, we should also call for help. So if someone is showing any or those signs that I mentioned earlier, call ahead to your local emergency facility, notify the operator that you are seeking care for someone who has or may have COVID 19. So you should call help if someone has symptoms or may experience symptoms or has an exposure to someone who has a COVID 19. So that's the end of my presentation. Thank you for listening. God bless and keep safe.